morning, everyone. We have a special guest with us today. We have Kevin Bond, who's the Chief Medical Officer at Walgreens. And it's fantastic to have Kevin today with us to discuss the future of pharmacy, which is a very relevant topic today. Healthcare is at a precipice of changes, multiple changes right now. Digital transformation is moving towards healthcare in a very big way. The past year, 2020, has been quite revealing in terms of our supply chain, our ability to address our patients, how we exactly interact between the supplier, the patient, and the folks in between, the enablers, the pharmacist. So today's conversation is particularly pivotal, and I'm excited to hear the thought process from Kevin. And without any further delay, Kevin, welcome to the show here. Thank you.
Thank you, VJ. It's great to be here. Maybe by way of background, I'll share with people. You're right, I'm the Chief Medical Officer at Walgreens. I joined the company in January of 2020, so just a couple of months before the pandemic really took hold, and I'd be happy to go more deeply into that. It was kind of a wonderful way, actually, to start in a role. Before that, I was Chief Medical Officer at Athena Health, but only after a career at Beth Israel Deaconess Medical Center and Harvard Medical School. It's where I trained. I stayed on there as academic faculty and worked predominantly during those years in a joint venture between Harvard Medical and the Tuscan government to work at the University of Pisa, University of Florence and Siena. So sort of an eclectic approach to a career that gravitates around population health. And then maybe here the focus today is what role might pharmacists and pharmacy play in the future of that. So I hope that's helpful.
Now that's something I would have never guessed, Kevin, honestly. That is very interesting, and I'm very keen to explore the aspects of population management experience that you brought about earlier. Can you speak about population management and why that's particularly interesting at this time in the global status of what's going on?
Well, I'll tell you, it's one of those things where, I started my career deeply entrenched in fee-for-service. I never thought of it as fee-for-service. I just thought of it as how we took care of patients. And I was pretty darn convinced that it was the best way to take care of patients. And it was my experience in Italy. I mentioned that I was there for about an 8-year period where I learned more about what it means to care for a population simply because they have socialized medicine. And almost embarrassingly, I should say, things that we thought were curious and even funny are now things that we actually do as we think more about managing large populations towards outcomes and instead of just being paid for the services that we provide. So upon my return from Italy, I was back and forth really, but when that project ended, I became the Chief Medical Officer within the BIDMC system at one of the community hospitals. And I learned a lot more about how to really crosswalk our physicians who were predominantly fee-for-service into value-based care. And I became really fascinated by it. I didn't think it was perfect. I thought it was full of problems. But the more I thought about the concept of just incenting people to drive outcomes, the more I liked it. And that was largely the background that helped me make the decision to leave BIDMC and Harvard Medical School to go to Athena Health. And there I was tasked with working with healthcare systems across the country who were entering into or already in population health management to provide them technology tools essentially to support that work. And so it was a great opportunity for me, VJ, to kind of just get outside of the Boston bubble and to see what was happening across the country. And that's really the backdrop that paved the way toward Walgreens.
Excellent. One of the thought processes that we're familiar in the healthcare industry is patients are the most underused resources of healthcare. it's always a one-sided equation. There's more patients can do to engage and take an active role. In similar tone, pharmacists are the most underused resources of medicine. Yeah, especially in America, being a global technologist myself, I've had experience in consuming healthcare in various countries, and the experience of what a pharmacist does here, it seems to be changing. What are your thoughts on this, Kevin? I'm fascinated by the whole concept of the distribution and supply chain that Walgreens brings to the table, right? There's so much to talk about just in that. But on the other side, this is a pivotal moment to understand things are changing. You see big players like Amazon bringing in different capabilities into healthcare. Well, we obviously have the big mammoth elephant in the room, which is the healthcare itself from Congress. So that's a whole other discussion. But to kind of bring this into a thoughtful process to understand and consume the role of pharmacist and the role of pharmacy, how do you see this unfold in the years to come, Kevin?
There's so many different ways, VJ, that I could approach this question. I'm not even sure what the best way is, but what I will say is that as I was practicing medicine, and as I became more involved in risk contracts, the power of getting medication management right became more and more apparent to me. You know, I chaired the utilization review committee, and we would discharge patients from the hospital with what appeared to be pretty good plans, and inevitably they would break down, and often that would be around medication therapy management. And I really began to appreciate how important the synergy between medicine, primary care medicine, let's say, and pharmacy, how important that really is. And so you know, that's sort of the first step, is that medication therapy management, even the concept just of medication reconciliation, which is understanding which meds a patient is on, is extremely complex and leads to a bunch of bad outcomes. Said in a different way, when you get it right, you can drive exceptionally good outcomes. And for anyone who may be wondering about what I'm talking about, I would say, you know, tell me right now what meds your mother, father, brother, sister, or spouse is on. Tell me the med, the frequency, the dose. I'm going to guess that the overwhelming majority of the people listening to this right now will struggle to answer that question. Now imagine I'm your emergency physician, and that family member, I'm caring for that family member, and I need that information. So really basic things around medication management are fundamental. Now, you talked about the pharmacist and the role of pharmacy. And what I would say is, I agree with you that the pharmacist is likely to be one of the most underutilized resources in the healthcare system. And this despite the fact that they're often embedded in community. At Walgreens, we have 9,100 communities with a Walgreens there. And so they're immediately accessible, and they're highly respected. People really like their pharmacist. And so one of the reasons, if you wonder, like, well, why did you make that leap to a certain extent from academic medicine, then into medical technology towards Walgreens, it's because of that power that we have in community. And one of the things you learn about population health management is that in the end, you've got to meet people in that final mile. And we are there. Now, you talked about Amazon, and there is no doubt that we will see more and more organizations, especially those who want to drive digital solutions, enter into healthcare. And I remain somewhat convinced that healthcare is a personal thing. It's about people. Right. And so I am less convinced that patients want their primary care doctor, their healthcare provider, or their pharmacist disrupted. I think they want the system that prevents them access to their healthcare provider or their pharmacist to be disrupted. All right. Like we have a system that precludes us from easily accessing care. And this is true across the entirety of care, but especially in underserved areas. And so I think that's what people want. They're not looking to get rid of the personal connection. They're just looking to facilitate their access to care and their navigation through a system that is, complicated and at times infuriating. For anyone who thinks that we have the best healthcare system in the world, that suggests to me that you haven't had the opportunity to try to navigate through our system when it matters most with yourself or a loved one. Almost everyone who does realizes that we have a lot of progress to make.
Excellent point there, Kevin, actually, in terms of the actual appreciation of the quality of the care, the personalization of the care. Now, kind of taking a little bit of a deep dive into the digital topic, what we saw in the past year was virtual medicine actually became essential. It was not an option. It became essential for a lot of us. Now, if you take that particular perspective, what you're basically kind of emphasize here is that enabling technology to deliver the last mile is a much bigger conversation than actually disrupting the healthcare perspective. If I got that right, that's a very different conversation, and the role of the pharmacist there is much more clearer and pivotal in terms of enabling that function.
Yeah, it's going to be interesting, VJ, to see where the dust settles after the pandemic as it pertains to digital health. Let's call it that. I frequently, I'll say it in a different way. I am not convinced that there is any one technology that is going to disrupt healthcare in a way that we're going to wake up one morning and go, wow, this is really different. I think what will disrupt the way we deliver healthcare and the way people receive it is payment reform, right? So when you change the way you pay providers to deliver care, then you start to see change. I think of technology as being a facilitator, an enabler to a certain extent of those changes we'd like to make. And then it also allows us to scale. And so that's really what I think the role of technology and digital health is. A lot of people were just, blown away by the percentage of people who went from in-person visits to digital, through telehealth visits. I'll get these numbers wrong, but they were probably less than 5% of visits before the pandemic, and probably got as high as 80% of visits. The interesting thing is I talked to a lot of large healthcare systems and payers, and that's starting to go back. And that sort of speaks to that point I made earlier, which is, there's a connection here that people want. I think what we'll see is that people now recognize that there's power in telehealth and that there's a way to utilize it. They don't want to necessarily go 100% towards, telehealth, but they'd like to figure out where the balance is. And then I think because of what happened a lot through regulation throughout the pandemic, we're seeing a lot more in terms of interoperability, which is fundamental to driving great outcomes. So when you ask, I think that's probably the most powerful thing that came out of the pandemic so far, is that we're starting to see that because of regulation allowing and really pushing more interoperability, we're going to pave the way towards doing things that I think will really be helpful to that facilitation of care, that scaling of care. But I got to be honest with you, I don't know where this is going. It'll be fascinating to see where it all lands.
That's actually a great point, and it segues into our next thinking about data interoperability. There are different perspectives to this. In this case, we're talking about patient data. We have the FHIR. The predecessor of FHIR was our HL7. Now, obviously, if you look at our core patient platforms, you're beginning to see some form of interconnectivity, right? That's great. Now, we can start introducing topics like practice analytics, patient analytics, the interoperability analytics that was unavailable to us just about a year ago. We are now beginning to see that piece of information democratized. Now, if you take a step back, Kevin, and really look at what's driving the role of pharmacy, some of the factors that come to my mind is we have an aging population, right? Number two, we got earlier diagnoses would be really helpful in order to control the cost of care down the road. Number three is rising expectations, both from the patient, the caregiver. If they are aging population, they are in a different spectrum. And then we finally have technologists who are really pushing multiple pieces of technology. And I hear you quite clearly, there is no single technology, but there's a lot of cluster of newer disruptors that are trying to take pieces of the workflow and trying to solve a problem. Now, the key question here in that case, Kevin, looking at what you just said, would be, if you consider these drivers, can a pharmacist, in one recent study in JAMA, basically patients actually speak to their pharmacist almost 3.1% more than their primary physicians. So I feel like the role of the pharmacist is a very crucial one. We have already established that. But how exactly, say for example, from your seat as a CMO, how are you seeing the supply chain aspects of this thinking play out?
Well, look, I'm not sure I'm specifically responding to your question, but I'm going to answer a question that I have in my head, VJ, if that works.
Sure.
And I think you're headed here, which is, I really look at the pandemic as being a tremendous amount of wind in the sails of pharmacists and pharmacies. What we have learned over the course of the last 16 months is that our pharmacist embedded in community, immediately accessible, trusted, can be a tremendous resource in a time of great complexity and ambiguity. To be able to go in to the pharmacy and to get the basics that you need and to gain some understanding from them is invaluable. Now, we also saw that we can play an expanded role in terms of, let's say, something like ancillary services. So testing is something that Walgreens before the spring of last year never did. And now we are, up across more than 6,100 stores doing COVID testing. And I think that people will look at that and say, yeah, that's really convenient. That to me is a very valuable service that can be offered oftentimes less expensively than other places that are more centralized. It drives a ton of value. So what we're seeing now is we're gaining permission to offer ancillary services that previously you may not have thought about going to. Now, that's not new, VJ. That happened with the vaccine program. We started the vaccine program, more than 10 years ago, but it was H1N1 that really put wind in the sails of that program. And now, 10 years later, 15 years later, it's pretty common for a person to go and get their vaccination at a retail pharmacy. And I suspect the same will be true of a lot of ancillary services that people will have no problem going and doing in their pharmacy. But more importantly, or maybe equally as important, is I believe that we'll see an expanded role of the pharmacist. And we're already seeing this in terms of regulation, and there's room to do this. And so if you think about pharmacists and the role that they've played sort of on the continuum of what they might do, on the left side of the continuum, they do the basic things, which is filling prescriptions and doing drug utilization review. And then what we're beginning to see is, of course, the next sort of bucket is medication therapy management, which is a hallmark of what a lot of pharmacists do, adherence, therapeutic interchange, these types of things. And I think the next step is that we're going to be embedded more and more on care teams, and we're going to play more significant role on care teams. We'll be involved in identifying gaps in care and then closing them. There may be collaborative practice agreements that we work with healthcare providers to make sure that we're driving the best outcomes. Social determinants of health, a huge issue when you're dealing with population health. In fact, maybe my biggest learning point as a doctor coming into pop health, I thought, well, this is going to be about diagnosis and treatment. And the truth is it's more likely to be about managing behavioral health and social determinants of health. And that's a really important role that a pharmacy and pharmacist could play. And so we're seeing that evolution. And then you may, and I think we will even see pharmacists as a professional who might make an assessment of a patient, make the diagnosis and then treat them, and then do that in collaboration with local healthcare systems. So I think that the pandemic really opened up the way for pharmacists and pharmacies to play a more significant role in healthcare, and then add on to that all of the data that can be used, to your point, to drive better outcomes. And I think that's a really exciting future for organizations like Walgreens.
Now, that's excellent. You not only covered the core of where I was going, but you kind of laid the segmentation for the next two topics here. But for the purposes of our audience and who's going to tune in later, the perspective I took away from the detailed conversation there is that, there are three different aspects the pharmacists will likely influence. I think I can break it down into the digital, medical, and behavioral, right? So the digital aspect is the enablement of how the patient interaction with the pharmacist happens using the technology. Hey, have you taken the medication? Let's open the app, make sure the therapy adherence is really working. Number two is the medical dimensions, as you rightly pointed out, and your thought process around how exactly can we assist in early detection. And then the last piece is the behavioral, which I think you covered pretty well. Now, that kind of opens up a point here, which is you're slowly moving towards a lot of data collection already, assisted AI. This is the angle where the bigger players are beginning to scramble all of patient data, think about making prediction based on historical data patterns, and then say you possibly need to be getting your shingles vaccine in the next 5 years, as an example. So AI is beginning to play an interesting part. Now, to lay this bigger conversation, we don't have, our HIPAA compliance is great, our data usage of patient records is great, but we don't have a clear usage of AI-assisted data. Then on the second generation of thinking, as from a Walgreens perspective or CVS perspective, we are just about developing the global supply chain perspective of how to interact with assisted technologies. And then the third dimension is you have the patient themselves, the most underutilized in the equation. What type of technologies they're able to buy off online? Everyone has a pulse oximeter right now. Everyone is recording their blood pressure right now. So all the data is also going somewhere. So what are your thoughts, Kevin, from purely thinking about AI, and how does that figure out in your strategy?
Yeah, it's funny. You have me thinking about big data, and of course, having really gotten closer to population health management in 2008, 2009, that was here in Massachusetts through the Blue Cross Blue Shield AQC contracts, the alternative quality care contracts. And then leading into the Pioneer ACO and other programs that I've been involved with, the big data has sort of been all around. And we've made tremendous progress in first of all, aggregating and normalizing big data. That's a big deal. It's become something of a commodity, I would say, but 10 years or so ago, it was cutting edge almost. But now the question is like, well, what's the future of big data, especially in the context of having much cleaner data, and I think AI can play a big role here. So what I'm beginning to see is that big data you mentioned. For example, let's take something like vital signs. Okay, so inundating a healthcare provider with a slew of heart rates and respiratory rates and temperature or whatever else you can think of through all of the different devices that people have is mind-numbing and usually does not drive better outcomes. However, what we're beginning to see is through AI, you're able to overlay the AI onto that big data, and you're able to say, hey, that heart rate, that blood, you might even get blood pressure, that heart rate, that respiratory rate, that that patient's temperature, whatever it is beginning to fit a pattern of fill in the blank, COVID, or it might even be just some infectious disease. And then they can even go farther at times and clean it up and be able to differentiate between flu and COVID. So it is that capability of taking big data and progressively making it more actionable by providers, whether that be a healthcare provider like a doctor, a nurse practitioner, or a pharmacist in community, is I think going to be very important. I'm reluctant to say game changer because I've seen very few game changers, but that is where we're going to see a lot of value. And then when you start to embed the things into that equation which are non-clinical and speak to social determinants of health, then you really get some very powerful, actionable data, and that's what usually catches my eye when I think about AI and how it may be used. Now, that's in terms of driving clinical outcomes. I think it's already been shown that when it comes to administrivia and all of the things that kind of make most people crazy, AI is very, very useful, very, very helpful. And in fact, that's where we've seen most success is more in the administrative functions that need to get done. But I do believe that there's a future also in the clinical care of our patients.
Brilliant, Kevin. On that positive and enterprising thought process, we are on time here. I think we can continue to speak for hours together on this topic. It's like we're just starting to skim the top layer. But I am excited to have you on this session. Thank you so much for your time, Kevin. I really appreciate all your thoughts.
Thank you, VJ.